Let us now review some points related to post-surgical care to help with safe and smooth recovery at home. Pain is expected since bone, muscle, and soft tissue has been cut and manipulated. Much like after an intense workout, we may experience a peak of swelling and discomfort 2 to 3 days after surgery, which will improve over time. Pain can fluctuate throughout the day. When it comes to pain management, we would want you to use multimodal approaches, which can be ice and elevation for swelling, medications including narcotics or non narcotics, activity for blood flow and stiffness prevention, rest to allow recovery time. We want you to know there has to be a balance between activity and rest. You need to pay attention to your limits and allow for periods of rest. Aim to slowly increase your daily activity as your pain improves. Swelling is a normal reaction to large surgery like a hip and a knee replacement, and some swelling is expected as a part of healing process, and just know it will improve over time. Icing helps calm excessive swelling after surgery. Your surgeon usually teach you to ice about 4 to 5 times per day. If you use the ice gel pack, do not leave that pack on for more than 15 minutes. But if you're using ice in a bag, just like the ones a hospital provides you, you can leave that pack on longer for about 20 minutes. Regardless of what you use, always make sure you have a layer between your skin and the ice, like a thin towel or ice wrap. Do not leave ice on for hours at a time. This can lead to skin damage, wound healing issues, and swelling reduction becomes less effective as the body may consider cold as its new normal. Elevation helps accumulated fluid in your lower leg and knee drain out, thereby reducing the swelling. Even hip replacement patients can have significant foot, ankle, and lower leg swelling after surgery. We would want you to plan to elevate your surgical side while laying down on a sofa or a bed at least 4 to 5 times while you're icing when you're resting throughout the day. It is important to elevate the leg above the level of your heart or toes above your nose. For those with knee replacements, make sure your leg is straight when you elevate. Please refer to the picture on the right ways to use pillows on how to elevate your leg. We want you to avoid resting the knee in a bent or flexed position for long periods of time early on in your recovery. This can cause tissue tightening, making it even worse and more difficult and painful for you to extend your knee. Support the entire leg, including your calf, with pillows and insert a small towel roll under your ankle. Plan to have your feet rested on the floor only with meals at a table initially. Otherwise, have your feet up when you are in a recliner or on the sofa to ensure that the swelling does not pool in your lower legs. Medications to support your recovery are designed to help you be comfortable enough to sleep, get through your PT exercises, and perform daily activities. The medications are not designed to relieve all the pain, especially in the first days after your surgery. Your surgeon usually prescribes two types of pain-related medications: narcotics and non-narcotics. Non-narcotics medications should be taken regularly on a schedule, usually for a few weeks. While your doctor orders may vary based on your history and needs, mostly patients do receive Tylenol. It's also known as acetaminophen. Tylenol has shown to help reduce pain at a huge rate. We do not want you to take any other over the counter anti inflammatory medications without your doctor's approval, as some anti inflammatory medications can contribute to increased bleeding. Narcotics or opioids, pain medications, may be also ordered as a support to other multimodal treatment, but in many cases, these are not needed or used. Examples of opioids include oxycodone, hydrocodone, hydromorphone, which is also known as Dilaudid. Only take these medications as prescribed and only when other measures do not help you. The goal is to use this medication as little as possible or even not at all. Opioids come with multiple side effects, including nausea, vomiting, constipation, and risk of dependence when you're taking it for weeks longer than expected. We would want you to start with the lowest dose possible and never take more than prescribed. We would want you to monitor yourself for feeling oversedated, confused, or dizzy. Communicate any issues with your doctor's office. Once you find the dose and frequency that suits your body, we would want you to plan it to gradually decrease the amount or also even stretch out the time between each dose as your pain naturally improves over days or weeks. Your hospital nurses or surgeons' offices may speak with you about weaning off the narcotics. Constipation is a serious issue to prevent and treat early. Anesthesia can slow down your GI motility, making it even much longer for your stool to move from your system. Anesthesia also pulls moisture from your whole body, leading to dehydration. Narcotics such as oxycodone can also slow down your digestive tract. Decreased exercise during the initial recovery phase also makes your GI system sluggish. It can be normal to not have a first bowel movement until 2 to 3 days after surgery. Your doctor may have asked you to take a over-the-counter stool softener, such as Miralax. You can start taking these medications a few days prior to surgery if you have chronic constipation. We would want you to continue these medications until your first bowel movement and also as long as you're taking narcotics or your regular stool pattern is returned back. If you do have a history of constipation, you do have to follow much more aggressive medication regimen. And also remember to drink water, eat fiber-rich food, and avoid any constipating food, for example, cheese, processed or fried food. It helps to be aware that what you need to know or what to expect after surgery or what may be abnormal, what can be normal findings. So the normal post-op findings can vary from person to person, but they can also include pain or discomfort, which is made more tolerable with medications, activity, ice, positioning, or rest. A higher than normal temperature for a day or so, bruising around your surgical site into the leg or ankle, drainage, spotting on the bandage, swelling that comes and goes on the surgical site, a delayed first bowel movement after surgery, or mild constipation, incision that may feel numb. These symptoms are generally part of healing process and they should resolve over time. Whereas abnormal findings or experiences include pain that continues to increase and is not relieved by the recovery routine, temperature over 105 degrees with chills and night sweats, bruising that continues to darken and spread for days, drainage that continues 3 or more days after surgery, saturates your bandage, and or does not continue decreasing. No bowel movement for over 3 days with increasing abdominal pain, nausea, or vomiting. If you experience any of these symptoms, please do call your surgeon's office immediately. Though more serious complications are uncommon, but we still would want you to know what to look for and what to do if a true complication should arise. Let's start with blood clots. A DVT or a deep vein thrombosis is a blood clot in your vein, which is typically formed in the lower leg after periods of immobility or after a major surgery. Signs of a DVT include new or excessive swelling, spreading redness, new tenderness, or significantly painful lower leg, and also increased heat around the calf area. If you suspect a DVT, we would want you to contact your physician office as soon as possible. Whereas a PE is a blood clot that has traveled to your lungs, And signs of a PE include shortness of breath, coughing blood, or chest pain. If you suspect any of these symptoms, please call 911 immediately. You can prevent complications like blood clots by moving throughout the day to keep your circulation flowing, performing ankle pumps while sitting, and remembering to take your blood thinner medication as prescribed. Another potential complication is pneumonia. Anesthesia and narcotics can make us breathe more shallow as it sedates and relaxes the body, risking pneumonia. Pneumonia presents with high fever, coughing, difficulty taking deep breaths, sweating, and also flu like symptoms. To prevent this serious side effect, we would want you to try to wean off any narcotics you might be taking as soon as possible. Take some deep breaths often and use your incentive spirometer throughout the day when you're still taking any narcotics. Walking also helps expand the lungs naturally. A more complex complication is the infection. We want you to be aware that it is normal to have redness and warmth at the site of a new surgery. Signs to report and monitor for infection include redness spreading steadily beyond the bandage borders, fevers of 105 degrees or more, 100.5 degrees or more, increased pain with motion for prolonged periods of time, pus-like drainage. Prevention can be accomplished with some key tips. That means we would want you to try not to smoke, do not smoke. Ask your PCP or surgeon for smoking cessation tools before you have your surgery. Focus on good nutrition. Only shower per your surgeon's instructions. Some bandages are waterproof bandages, but you still have to be aware of getting water and bacteria into the wounds. Your nurses will be discussing bandage care and shower instructions at discharge. Be careful with the pets around your incision or bandage. We would want you to keep your incision covered per your surgeon's instructions. The bandage should always be clean and dry and intact and usually left in place until your first follow-up visit. If you do have any concerns related to your bandages or dressings, we would want you to reach out to your surgeon's office and they will provide you further instructions. A complication specific to hips only is dislocation. This can occur after a fall or injury. Ignoring your hip precautions and moving in improper ways can lead to dislocation. Signs of this rare and preventable issue include a loud popping noise followed by severe and sudden pain in the hip, your hip or knee appearing twisted in or out, numbness in your foot, ankle, or leg, not being able to move your leg easily. The key is the key to prevention is being diligent about following your hip precautions for 6 weeks after surgery and do everything in your power to avoid falls or any fast, jerky movements. A last complication more specific to knees is loss of flexibility. Stiffness is normal during the healing phase due to inflammation, but if you are not doing your exercises and stretches, scar tissues can form and loss of flexibility can be permanent without procedural interventions. Key components to prevention include completing your range of motion exercises 3 times a day or as instructed by your physical therapist, icing and elevation to reduce inflammation and swelling, balancing movement throughout the day with not overusing or underusing your new joint, keeping your knee straight when resting and not placing a pillow directly under your knee only. A tip that cannot be said enough to prevent any complication is do not fall. A fall may lead to a fracture at your surgery site, especially in the critical 6 weeks of healing. We would want you to take care of yourself so you can get back to your normal, improved mobility as soon as possible. Be aware that your balance is affected when you adjust to your new hip or knee. Therefore, we do not want you to shower if you feel dizzy at all. Be aware of using the toilet also, because it takes a lot of coordination to sit and stand safely. We would want you to follow your PT's instructions very closely. Remember to sit for at least 1 minute before standing when getting up from bed, and pause before walking once standing. This allows your blood pressure to adjust so you don't feel dizzy and risk a fall. And do not be shy about asking your coach or a visiting friend to help with picking up fallen objects, transporting a meal tray, cleaning a spill in onto the floor. So having a coach is very, very, very important. In conclusion, we would want you to reach out to your surgeon's office if you're experiencing any abnormal symptoms or concerns or have any question. There's always a doctor or a PA on call available if you listen to after hour voicemail and follow the instructions. Another option for less emergent questions is Overlake's Total Joint Helpline at 425-688-5579. An orthopedic care team member will get back to you within 1 to 2 business days. About 7 to 14 days after surgery, you will have to have your first post op appointment with your surgeon. Your bandage will be removed, and the underlying staples or sutures will be removed as well. Your incision is assessed, and further care instructions are given to you at that appointment. Any further planned follow up appointments will be scheduled per your surgeon's usual time frame. Once home, we would want you to plan to continue with our hospital provided exercises 3 times a day until your outpatient physical therapy gives you additional instructions. You are to start working with your outpatient physical therapist within 5 to 7 days following your surgery. Plan on 2 times a week in the beginning, and then your physical therapist will discuss on how often you need to do PT. During your recovery, be sure to use your front wheel walker every time you walk. Your PT will tell you when you're ready to transition from a walker to the cane and then to no assistive devices. We would want you to not be driving to your first follow up appointments or PT appointments, so plan your rides ahead of time. Ask your surgeon at your first follow up when you are safe to drive. Your hard work and preparation will pay off. We all look forward to you feeling your best and returning to a fuller and more mobile life. Thank you, and we look forward to seeing you soon.